Multilink Automix is a self-etching universal adhesive resin cement designed to provide high immediate bond strengths to dentin, enamel, and all types of restorative materials, including IPS Emax and IPS Empress. The following video outlines the proper step-by-step procedures for Multilink Automix to maximize bond strength and minimize post-operative sensitivity. Ceramic restorations must be etched with hydrofluoric acid to roughen the surface. This procedure can be done by the laboratory or chairside by the dentist. Using a 5% hydrofluoric acid, IPS Emax restorations are etched for 20 seconds, while IPS Empress restorations are etched for 60 seconds. Thoroughly rinse and dry the surface after etching. The ceramic restoration should only be etched once. If receiving your restorations from a laboratory, please check with your laboratory to see if they have etched the restoration before performing this step in your office. Follow manufacturer's instructions for use to prepare the surface of all other types of restorative materials. The restoration should be cleaned after intraoral try-in. The most effective cleaning method is Ivoclar, a universal cleaning paste that effectively cleans the bonding surface of dental restorations after intraoral try-in and therefore promotes the formation of a strong bond with adhesive cementation systems such as Multilink Automix. After the restoration has been tried in the patient's mouth, thoroughly rinse the restoration with water spray and dry with oil-free air. Before proceeding, be sure to shake the contents vigorously. Cover the entire bonding surface of the restoration with a layer of Ivoclar using a microbrush. Allow 20 seconds for the cleaning action of Ivoclar to take effect. Thoroughly rinse with water spray and dry with oil-free air. The restoration must be primed to create a strong bond between the cement and the restoration. Monobond Plus is a universal restorative primer designed to generate a strong bond between all types of resin cements and all types of restorative materials, including ceramic, metal, and zirconia. Monobond Plus is applied to the internal surfaces of the restoration, including the margins. To enhance cleanup, avoid getting the primer on the outside of the restoration. After application, set the restoration aside and allow the primer to react for a minimum of 60 seconds, and then air dry any remaining primer. Once the restoration is primed, it's important to protect it from contamination. Prior to adhesive cementation, the preparations should be cleaned and dried, leaving the dentin slightly moist. An over-dried preparation will lead to post-operative sensitivity. If you intend to utilize a desensitizing agent, such as Telio CS desensitizer, it should be applied prior to the application of the adhesive. Preparations are conditioned using Multilink self-etching primer. It's important to note that Multilink self-etching primer must be used with the Multilink luting composite to initiate polymerization and to maximize bond strengths. Start by dispensing equal drops of primer A and primer B into a mixing well. Strive for a 1:1 ratio. Mix the primers together using a microbrush for 2 to 3 seconds, and then apply the mixture to the preparation. Apply the A and B primer to the prep. Start scrubbing on the enamel and work into the dentin for a total of 30 seconds. Any risk of post-operative sensitivity will be greatly reduced by applying sufficient amounts of primer and by scrubbing the primer into the dentin and enamel. After application, air dry the Multilink primer until any standing liquid on the preparation surface is no longer visible. To enhance cleanup, avoid splattering the primer to any adjacent teeth. This will keep excess cement from bonding to the adjacent teeth. Begin dispersing the primer with light pressure and gradually increase the pressure as the primer dries. Bleed the Multilink Automix syringe and apply a new mixing tip. Dispense the desired amount of Multilink Automix directly into the restoration. Seat the restoration onto the prep and maintain pressure. Choice of cleanup technique is up to you. One option is to immediately remove excess cement using a rubber tip, microbrush, or dental floss. Maintain pressure on the restoration. Be sure to remove excess cement quickly in hard-to-reach areas, as the cement will begin to rapidly polymerize once it is in contact with the self-etching primer. Expose the cement to a curing light for 1 to 3 seconds from each side of the restoration. This will partially polymerize the cement into a gel-like consistency for a quick and easy cleanup. Excess cement can then be easily removed with a scaler. Use dental floss to remove excess cement from the interproximal areas. As an optional step, place liquid strip, a glycerin gel, on the margins to cover the oxygen-inhibited layer to ensure all layers of the cement are completely polymerized. Light cure each side for 20 seconds on high power. Multilink Automix provides high immediate bond strengths to all types of restorative materials for long-term success when the proper protocol is completed. For additional information, please go to www.ivoclarvivadent.com.